Welcome back to the class, students. We are today going to discuss a new chapter, and the name of the chapter is Hospital Waste Management. It is an important issue because we have a lot many hospitals nowadays and hospital waste management remains neglected. The government tries to have a lot of rules and regulations for the proper waste disposal from the hospitals, but this still isn't in its infancy. What you need to know is that hospital waste is not your household waste. Hospital waste differs from the household waste in a lot of aspects. For example, it can be infectious, it can have organs, it can have blood products which can be very disturbing for the general population. It can also serve as a source of disease. So therefore, we need special rules and special guidelines for treating hospital waste. So let us see about that. The definition of biomedical waste then: any waste which is generated during the diagnosis or treatment, immunization of a human being or that of an animal, research activities and production or testing of biologicals is termed as biomedical waste. In short, anything to do with biology, anywhere where you have contact with organics, the waste that is produced is called as a biomedical waste. If you look closely, what we imagine is just the waste that is produced in the diagnosis and treatment. But as you see, it is a lot more than that. Even research activities, for that matter, testing of biologicals, immunization, animals. So a broad variety of waste is considered to be biomedical waste and thus comes under the ambit of the regulations. Sources of healthcare waste. So what are the sources where these healthcare waste routinely are generated? They are generated routinely in government hospitals, private hospitals and nursing homes. So these are the common places of generation of hospital waste, and physicians and dentist office. These are the minor sources of generation of biomedical waste. Medical research and training establishments are another important source which contribute to a lot of burden about these wastes. Other sources are mortuaries, blood bank, blood collection centers, laboratories, animal houses, slaughter houses, vaccination centers and biotechnology hubs. So this is a small representative list of where these kinds of waste may be generated. Coming to the classification of biomedical waste, it is classified as infectious waste, pathological waste, sharps, pharmacological waste, genotoxic waste, chemical waste, heavy metal containing waste, pressurized containers and radioactive waste. These words itself are explanatory. There is nothing to explain really there. All of you understand what these words actually mean. What are the hazards of these waste? As I told you some of the hazards, these hazards are also a representative list of what are the general hazards. There can be many hazards, like for example, if you have needles littering here and there, you can have pinpricks because of that. If the needle has got blood which is infected, you can also have that disease. So these are just examples of hazards that one can have due to indiscriminate disposal of biomedical waste. So you can have infections such as HIV, hepatitis B virus, hepatitis C virus and resistant bacteria. We know that hospitals are an assortment of chosen bacteria. People who don't get better in the community are the ones who come to the hospital. So hospital has got a assortment of bacteria. Many of them are resistant to treatment. Therefore, these can also spread. Chemicals and pharmaceuticals toxic waste, which are corrosive, flammable, explosive even, and may cause burns. So these are the hazards which are chemical and pharmaceutical hazards. You have waste which can be genotoxic. Fortunately, radioactive and genotoxic waste material is very less, at least in medical field. Genotoxic and radioactive waste are very less, and therefore, although they are very risky, because the generation is very less, the problem is not such a big issue. Coming to the radioactive waste, you have headaches, dizziness and vomiting because of radiation. Plus we also saw a lot of other effects that are because of radiation. You can also have anatomical or pathological waste, samples of appendix, brain or any other bodily tissue. If people are not accustomed to seeing this and general public is not accustomed to, they can get a shock. and it may hurt their sensibilities to look at these anatomical wastes. Who are the groups at risk? The groups at risk are obviously people who deal with these wastes, which are doctors, nurses, lab technicians, hospital maintenance personnel. Also, the patients themselves, because they visit hospital, they are at a risk of getting diseases in the hospital itself. Visitors for the patients, workers in support services such as laundries, waste handling, transportation. So anybody and everybody who actually touches the waste or directly or indirectly comes in contact with the waste is basically at risk. Generation of waste. There are established waste management methods and it is expected that these methods are followed. You have waste according to hospital specialization, depends upon what kind of hospital it is. If you have a clinic where you have just an OPD, there is no IPD, the waste here generation would be very minimal. As compared to say a surgical specialty hospital, the amount of biomedical waste generated at that place would be much higher as compared to the normal routine clinic. So it obviously depends upon the specialization of the hospital and the use of reusable items. Initially there was a lot of pressure on using reusable items. These days what we use is basically use and throw. Most of the items are single use and we do not prefer to use them repeatedly. Because of this phenomenon, hospital waste is increasing because we don't like to use our syringes or catheters again and again. Therefore, the waste generated from the hospitals is automatically increasing. Proportion of patients treated on a daycare basis. As I said, if it's just OPD, the patient comes and goes, okay, waste generation would be much less. But if the patient stays, then the waste generation would be high. High income countries, it is found that the waste generation is high, and what you follow is on your slide 3 typical examples of government hospitals, private hospitals and nursing hospitals, and you have the figures of waste generated at these setups. As you can see, government hospitals generate about half to 4 kgs of biomedical waste per bed per day. Private hospitals, it is half to 2 kgs, and nursing homes half to 1 kg. So you can remember that government hospitals have the maximum of upper limit and the nursing homes have the minimum of the upper limit. So maximum they generate only 1 kg waste per head per day. Important to remember, not really, but then sometimes asked. So you will have to again concentrate on the boundaries. Okay, so government hospitals the maximum is high and for nursing homes the minimum. 80% of the waste that is generated in the hospital or the so-called biomedical waste is basically domestic urban waste. So there is nothing special about it. Majority of the waste is like what you have in your typical household. However, 15% are pathologicals and infective waste. So this is the dangerous group. 1% of the waste generated is of that sharps. Sharps means anything that can puncture or incise. So sharp waste is 1%. 3% has chemical and pharmaceutical waste. So that is when you have your expired drugs or discarded medicines, those come under these. Less than 1% would fall into special waste, which like I told you would be radioactive waste, cytotoxic waste, pressurized containers, broken thermometers and used batteries. As you can see, you can have radiation, you can have mercury, you can have cadmium, you can have a lot of other heavy toxic metals, and therefore these are special wastes to be handled with a lot of precaution. Coming to the typical composition of a hospital waste, the composition is paper 15%, plastics 10%, rags 15%, sharps which are metals 1% as we already saw, infectious waste can be 1%, glass 4% and other general waste 53%. Bottom line is majority of it is general waste and then you have the rest. Sometimes it is asked what is the proportion of sharps that is generated. It may also be asked what is the most common waste, and that is the general domestic household waste also from the hospitals. So those would be some things that you would like to remember. Only 10 to 25% of the waste generated from a biomedical facility is hazardous. 75% are generated during housekeeping, which is the routine work that is done in the hospital like we have at our houses. 50% of the total waste is infectious. So 50%, say for example bed linen, it is also generated in the house, but the bed linen in the house is not infectious. In the hospital it can be infectious, and therefore 50% of the total waste can be infectious. In 30% only segregation is done. That is the story for everything here. Segregation is not practiced. When we have to dump something, we don't segregate into biodegradable and non-biodegradable or wet and dry. We just dump everything into a single plastic and throw that away. That is what is seen in the hospitals also. You see that only 30% segregation is done, which means a majority of the waste is not segregated, which is not a very good thing to have, because infectious waste and non-infectious waste are basically two very different things. I'll have to deal with them very differently. I am very much concerned about infectious waste. I am not that much concerned about plastics and papers coming out of hospitals, because they are as good as the other waste. If I mix the whole thing, then even the non-infectious material gets infection and thus becomes infectious. So segregation is important everywhere, but in hospitals, in biomedical facilities where these kinds of wastes are generated, it is of paramount importance. Coming to the treatment and disposal technologies for biomedical wastes, you have the following. We can do incineration, chemical disinfection, wet and dry thermal treatment, microwave irradiation. You can have land disposal and inertization. We will see what these are. First, we will come to incineration. Incineration, as we already discussed, as a method of waste disposal, but that was general waste disposal, is simply burning. We also saw the disadvantage: we lose valuable resource. In hospitals, that disadvantage is not so much conspicuous, because hospital waste really cannot be turned into manure. So incineration, basically burning, that is high temperature oxidation process, reduces organic and combustible waste into inorganic and incombustible matter. So what you get is just ash. Results in significant reduction of waste volume and weight. Waste selected are that cannot be recycled or reused. So something that cannot be recycled, something that cannot be reused, its lifespan is over, cannot be converted into something else which is useful, we would like to incinerate that. It is costly, but then it is a very good method of waste disposal. The ash that is left is disposed of at a landfill site, because once you burn everything, the ash that you have is basically non-infectious. Therefore, it can be safely disposed of in a landfill site like any other common waste. Requirements of incineration. Now these are common sense requirements. I don't want a lot of particles which don't burn. I don't want sand in it, for example, which does not burn. I don't want moisture, and I don't want wet things. Wet things won't burn. Particles like sand won't burn, and basically I want something which is combustible, which I can burn. So you should have the proportion of non-combustible solids below 5%, proportion of non-combustible fines such as sawdust or your sand below 20%, and the moisture content should be below 30%. Otherwise, the stuff that you are going to put into an incinerator simply won't burn. The advantages: requires no pre-treatment. This is important. If you decide in your exam paper that okay, this has to be incinerated, then pre-treatment is not required. Sometimes this is tested. For an incinerator, if you decide that it has to be put into an incinerator, pre-treatment is absolutely not required. Why waste time, money and manpower in that pre-treatment when it is already going to be burned? So, what are the types which should not be burned? From our common sense and general knowledge, you know that on every DO it is written highly flammable, do not expose to fire. Also in movies you see, you burn a lighter and you blow a DO and you have a big fireball. So those kinds of things. Pressurized gas containers should not be burned, they can blast. Large amount of reactive chemical waste should not be burned, can cause a lot of toxic fumes. Silver salts, photographic or radiographic equipments should not again be burned, because they have got a lot of heavy metals used in them and they can be liberated in the atmosphere. Halogenated plastics like PVC I think everybody knows that, but nobody follows this. Whenever you have cold, whenever you have something, the weather is cold, people burn paper and they also collect a lot of plastic and they burn it. Burning plastic is not a brilliant idea, especially PVCs. High mercury and cadmium content like thermometers and batteries again should not be burned. For that matter, mercury is a completely separate issue. Mercury is a very toxic environmental contaminant. We don't want mercury going back into the atmosphere. And remember, mercury, the cycle of mercury is okay only when it is in your hands. If mercury goes back into the environment, it can cause a lot of problems. So the best method for anywhere, if the question mentions mercury, recycle. Mercury, recycle. No waste treatment, nothing. If the STEM mentions mercury, I have to collect mercury, I have to recycle mercury. I can't throw mercury, I can't bury mercury, I can't put it into the flush, I can't burn it, nothing. Mercury is such a thing which once you have it on your hand, you have a problem. I can't dispose it off, that has to be recycled. Any mercury going back into the atmosphere is toxic. So remember that. Mercury is altogether a different issue. Also, you don't burn sealed ampoules or ampoules containing heavy metals. So you get the idea. Pressurized containers, heavy metals, toxic metals, PVCs, don't burn them. Types of incinerators, you have basically a couple of types of incinerators. The first is the best one, and that is a double chamber pyrolytic incinerator. Sounds hi-fi, is hi-fi and is therefore costly. Double chamber pyrolytic incinerators are the best, but they are costly. They are designed to burn infectious and healthcare wastes. The cheaper alternative you have is the single chamber furnaces with static grate. We had this single chamber furnace, only used if the first one is not available or you are not in a position to buy the first one, so you have the second one, the single chamber furnace. The third one is a rotary kilns operating at a very high temperature. So if you have this word kiln, that it automatically means that it operates on a very high temperature, and it is used for causation of decomposition of genotoxic substances and heat resistant chemicals. So usually things which are not destroyed by heat also get destroyed at such high temperatures. So these are the three types of incinerators. What you want to remember on this slide is double chamber pyrolytic incinerators. So that is the most important one. Coming to the next mode of disinfection, that is chemical disinfection. Chemical disinfection results in disinfection rather than sterilization. We know that it is very difficult to sterilize things because sterilization means destruction of all life forms including spores, and those are the hard ones. So therefore chemical disinfection is very much unlikely to cause sterilization. Liquid waste like blood, urine, stools, other hospital sewage can be treated satisfactorily by chemical disinfection. What cannot be treated satisfactorily is solid waste such as microbiological cultures and sharps. You can do it, it's not a contraindication, but it is not satisfactory. Chemical disinfection is satisfactory for liquid waste, urine, stools, stuff like that. But solid waste, it's not very good. Coming to the dry thermal process. You have a technology here which is called a screw feed technology, and it does exactly what it says. It screws, breaks down, and it burns. So that is the screw feed technology. Non-burn dry thermal process. You don't ignite like the incinerator, you just heat it, shredded and treated in a rotating auger so that everything is finely chopped. It is really hot, everything gets destroyed. Waste is reduced by 80% in volume. 80% is a big reduction, and about 20 to 35% by weight. So I am achieving my objectives, and is useful for infectious waste as well as sharps. So imagine a sharp object getting shredded, it is mutilated, cannot be reused, and it is also getting safe. It is a good method, screw feed technology. But it is obviously not suitable for pathological, cytotoxic and radioactive wastes. Radioactivity, nothing will happen. It will just smear the radioactive substance everywhere. Pathological waste, I cannot literally shred it and just by heating it won't get disinfected or sterile, because you know that tissues are not a very good conductor of heat. So you can have those cold pockets with surviving disease, and therefore these things are not to be put into the screw feed dry thermal process. Wet thermal treatment. Wet thermal treatment is basically steam disinfection. So like you studied in microbiology, steam is used for disinfection. It is very much similar to autoclave. High temperature and high pressure steam is used for wet thermal treatment, can be used for shredded infectious waste. It is not applicable to animal carcasses, anatomical waste, chemical and pharmaceutical waste. Again, the same logic. These things won't have a very good effect with the wet thermal treatment. So therefore, these are not indicated for wet thermal. Shredded infectious waste, yes, you can do that. We'll see the rest of the chapter in the next class.